This is a connective tissue tutorial presented by Dassi SchrDbb with reference Atlas of Histology with Functional and Clinical Correlation by Dongmei Cui. So here we are going to visualize connective tissue. We start with the introduction of connective tissue. Is that a connective tissue is made up of three main elements. We have cells, we have fibers, and we have ground substance. Those are the three main elements of connective tissue. The fibers is majorly made up of collagen fiber, elastic fiber, and reticular fibers. Now, the connective tissue cells. You need to know that the connective tissue cells are mainly divided into two. You have the fixed cells and you have the wandering cells. The fixed cells are the cells that are produced in the connective tissue proper and they stay in the connective tissue proper. You have fibroblasts, fibrocytes, osteoblasts, osteocytes. You have chondroblasts, chondrocytes. All those cells are produced in and they stay in the connective tissue. While the wandering cells are the cells that are produced out of the connective tissue and then they now migrate into the connective tissue. Example of wandering cells are the mast cells. Mast cells were initially basophils that have migrated into the connective tissue. Another example are macrophages. Macrophages were initially monocytes that were produced in the bone marrow and migrated into the the connective tissue. Another example are plasma cells. Plasma cells are initial B lymphocytes that have been produced in the bone marrow and have migrated in the connective tissue. So those are examples of wandering cells. So now we start with each cell. So you need to know that there are fibroblast cells there are macrophages, there are mast cells, there are plasma cells. Each of them have their particular histologic appearance that we are going to see later. You have leukocytes, you have adipose cells. So those are the different cells that you can have. Now the connective tissue fiber. For the connective tissue fiber, you need to know that they are mainly collagen fiber, and that we are going to see later. We have elastic fiber. We have an elastic fiber. Collagen fiber can be seen with hematoxylin and eosin seen without any problem. Now elastic fiber is going to be seen with, it can be seen with hematoxylin and eosin, which is going to have a glassy red appearance, but it can also be seen with an aldehyde fusion stain, where it's going to have is going to be best demonstrated with an aldehyde fusion stain. Reticular fibers. For reticular fibers, it is going to be, it's usually an argyrophilic fiber, meaning that it is absorbing silver. So it's going to be dark. It's going to be dark stain when you use it's going to be dark color when you use a silver stain. The next thing is the ground substance of the connective tissue. So the ground substance of the connective tissue is the background of the connective tissue. The connective tissue is made up of two main things. We have the cells and the fibers. And now what is inside in the space in between the cells and the fibers now is the ground substance. And the ground substance is made up of glycosaminoglycans. An example of these glycosaminoglycans, we have polysaccharides, which can be on branch. Is it clear? So depending on where you are located, you may have different forms of ground substance. Example, in the bone, the ground substance is going to be calcium hydroxyapatite. That is the inorganic part of the bone. Example, in different tissue, you may have keratan sulfate, you may have chondroitin sulfate, you may have dermatan sulfate, you may have hyaline, so you may have hyaluronidine. So those are the elements that we can have as ground substance. Now the next thing is even heparin. Sometimes heparin may be found inside connective tissue or also inside the cells type. Example, like in the case of the plasma cells, we may contain heparin, or it may also be found inside the connective tissue in order to prevent blood coagulation. Now The next thing that we are going to visualize now is a type of connective tissue. So the type of connective tissue, we have the connective tissue proper, and we have specialized connective tissue. So those are the two main types, with also embryonic connective tissue. So those are the so we have special connective tissue proper, and we have specialized connective tissue. Other connective tissue, we have embryonic connective tissue, we have supporting connective tissue, we have hematopoietic connective tissue. So those are the other elements. But the connective tissue proper is divided into two. We have dense connective tissue and we have loose connective tissue. For the dense connective tissue, it can either be dense irregular connective tissue or it can be dense regular connective tissue. Now for loose connective tissue, it is much more typically areolar connective tissue. Now for specialized connective tissue are the others connective tissue. We can have adipose tissue, which is made up of adipocytes. We have so adipose tissue are usually divided into white adipose tissue and then brown adipose tissue. White adipose tissue is when you are present in the childhood and adulthood, while brown adipose tissue is that one which is present inside the fetus. We have reticular tissue, which is used in the mesh sheet producing network of mesh or branch fiber, which is used inside in the supporting structures like the liver, the pancreas, and all this bone, even the bone marrow. So elastic connective tissue is made up of elastic fibers mostly, and it is used in elements that are involved. They are used in structures that are involved with high expansibility, like the arteries. Large arteries which are withstanding high pressure from the heart should have these elastic tissues. Now, other connective tissue, we have embryonic connective tissue. Embryonic connective tissue, example of embryonic connective tissue, we have mesenchymal connective tissue, we have mucous connective tissue. Now, mesenchymal connective tissue, so it's one where it is a connective tissue that make up the mesoderm. It usually make up the mesoderm of the embryo. Now, mucous connective tissue is what make up the Wharton jelly, and the Wharton jelly is that jelly that covers the umbilical cord. Now we have supporting connective tissue. Supporting connective tissue are those connective tissue that are used to support the body, like the bones and the cartilage. And the last one is the hematopoietic connective tissue that is involved with the blood elements. So that is what we're going to see. So these are the hematopoietic connective tissue. I'm not going to emphasize on the hematopoietic connective tissue much here because they are going to be seen later. So now you need to know that you have undifferentiated mesenchymal cells and you have hematopoietic cells. So undifferentiated mesenchymal cells, you need to know that what we have chondroblasts are going to produce chondrocytes. These are cells. We have adipocytes inside the connective tissue. We have fibroblasts inside connective tissue. We have osteoblasts inside connective tissue that are going to produce osteocytes. Now for hematopoietic stem cell, the B lymphocytes are going to produce the plasma cells. The monocytes are going to produce the osteoclasts in the bone or macrophages in other connective tissue. It's going to produce the mast cells and it's going to produce the basophils. Sometimes it's said that the basophils and the mast cells have the same etiology because of their appearance, but sometimes because of their content, but sometimes it's said not to be the same. The eosinophils also come from hematopoietic stem cells and the neutrophils. All these cells here are the lunging cells, while these cells here are the fixed cells. Now, the next thing to visualize is the other elements. So the cells of the connective tissue. We have fibroblasts. Fibroblasts, you have it's a spindle shape. Fibroblast is or it has an irregular shape or spindle shape, as you can see here. Fibroblasts. You have macrophages. Macrophages have a single nuclei with granules inside, usually lysozyme. Adipocyte is having a fatty component vacuole inside here, and then the lower part is made up of a nucleus. The mast cells is made up of many granules which are eosinophilic and is centered nucleus. We have plasma cells. Plasma cells is made up of a nucleus that has an clock nucleus, and then is made up of this part here, which is the Golgi complex. Then the next one here is a basophil. Basophil has a very large nucleus and then it is blue shade, while mast cells, it is not blue shade, it's going to be eosinophilic. Neutrophil has a polymorphic nucleus and eosinophil has a two-lobe nucleus, which is eosinophilic. And then these are building force, and then the basophil are instead having having polymorphic nucleus, and then they are having basophils. They are having basophilic granules inside, that is blue granules inside. So now let's visualize each connective tissue. Okay, we have seen the schematic representation of fibroblasts. Now this is the histology representation of fibroblasts. So this is the fibroblasts here. The fibroblasts are called fixed cells. They are elongated. So when you see an elongated cells, when they are inactive, so when they are inactive, they are elongated. These cells have little cytoplasm. So you don't see actually cytoplasm, you mostly have a nucleus, little cytoplasm. Fibroblasts are formed and reside inside the connective tissue. That's why they are called fixed cells. These are fibroblasts here. They can be spindle, elongated, as you can see here. Now, the next thing are the plasma cells. How are plasma cells represented on histology? On histology, the plasma cells are characterized like the cartwheel phase. That is a clock phase. You see the clock here. It's as if it is a clock with the different points of the clock here. This is the clock phase. So that is a distribution. That clock phase represents a distribution of heterochromatin and euchromatin on the light microscope. And it also has a Golgi complex here at the level of the Golgi zone. These are the two main representations of plasma cells. Now the next thing is the mast cells. How do you see mast cells? Mast cell, it is made up of a single oval shaped nucleus, and there are also granules in the cytoplasm, and these granules are eosinophilic, but sometimes the granules are unstained on the hematoxylin and eosine stain. You can also see basophil here with granules which are unstained, but usually the granule may be stained with hematoxylin stain. Is it clear? And that is, it may have a clear, either it has a clear cytoplasm, or when you have hematoxylin, it's going to be eosinophilic. Now, the difference between both the mast cells and eosinophil have a eosinophilic granules, that is pink granules. The difference now between eosinophil and mast cell is that eosinophil, though it has pink granule, that's eosinophilic granule, it has a multi-lobe nucleus, that's a two-lobe nucleus. That's the main difference between mast cells and eosinophil cells. Now macrophages. Now how do you distinguish macrophages? Macrophages have black particles inside. When you use the hematoxylin, because macrophages are mostly used in phagocytosis, so when you use hematoxylin and eosine stain, you may see black particles inside the cells, the mast cell, because they are involved usually in phagocytosis. Now the next thing is adipocytes. The adipocytes, here you have the nucleus at one terminal, the nuclei are located at one terminal, and then you have a very large fat content, lipid content, droplet, which is clear on one side, a clear portion of adipose on one side. So that is for the representation of adipocyte. The next now is the connective tissue cells. So in the laminar, so we have already seen the plasma cells. Now the neutrophil, how do the neutrophil resemble? The neutrophil, they are made up of multi-lobe nucleus. That's usually 4 to 5 lobe nucleus. When you have 4 to 5 lobe nucleus, you already think of neutrophil. The content of the neutrophil can be eosinophilic most of the time, but may also be basophilic. But what is the most typical representation of the neutrophil is that the neutrophil has a multi-lobed nucleus that is greater than 4 to 5. So it may also have element of phagocytosis inside, that is dark granules inside it. So the next thing is representation. This is just a diagrammatic, schematic representation of the cells inside the connective tissue. The schematic representation of cells inside the connective tissue, we have neutrophils, basophils, macrophages, fibroblasts, plasma cells, mast cells, eosinophils, adipocytes. But this is a histological representation. Histological representation, you can see here macrophages, a very large nucleus, and then some granules inside. Is it clear? You can see fibroblasts, spindle shaped, as you can see here, fibroblasts. You can see lymphocyte, very small, and the nucleus overtake the lymphocyte. You see the nucleus is the whole cell, so there's a very small cytoplasm in the lymphocyte, just like the fibroblast, but the fibroblasts are more elongated while the lymphocytes are circular. Plasma cells and a clock appearance, that's a cartridge appearance. So everything you have because of distribution of heterochromatin and euchromatin inside the nucleus. Eosinophil, there has two lobes and then it has granules inside, you see. And then neutrophils, we cannot actually visualize neutrophils here except here, but it's not multi-lobe. This one is much more of a mast cell. So mast cell, yeah, this is mast cell. This is a B lymphocyte because of that clock appearance. This is also B lymphocyte because of that clock appearance. This is more of a fibroblast because elongated fibroblast. This is more of a B cell because of clock appearance. This is a macrophage. Is a macrophage here. So these are all the elements, but the neutrophils are not easily seen here. This is also a B cell because of the clock appearance. For the macrophages, so macrophages are going to be very large, as you can see here. Here also it can be. So here's the macrophage because it's very large, and then you have some element of phagocytosis inside. So now the clinical presentation, the clinical correlation of this is anaphylaxis. So anaphylaxis is just an allergic reaction that range from mild to severe characteristics. So it's an allergic reaction to an allergen. So it's a type 1 hypersensitivity reaction where you have a severe allergic response, a severe allergic response to a particular allergen. That's anaphylaxis. That's anaphylaxis. So it is just an allergy. Anaphylaxis is just an allergy, but it's a severe response. Now, the histologic view. What do you see on histologic view? Histologic view, you have dilated blood vessels in anaphylaxis. You have active basophils. Active basophils, you are going to see very high basophilic, so basophilic granules. The granules are going to be bluish, much basophilic granules. That is going to show you that it is very active. You have active mast cell. That is, you have a very pinkish pinkish granules. That is eosinophilic granules of the mast cells. So we have active basophils, active mast cells involved there. We have collagen fibers. They can be seen, but that's not the peculiarity. The peculiarity, you have also dilated cells. So all this can be seen in anaphylaxis. Mostly active basophils, active mast cells. Now, this is how the mast cell is going to be represented. So mast cell representation with toluidine stain, because we said that on the hematoxylin and eosin stain, mast cell may not stain well. It may be clear, but sometimes on hematoxylin and eosin stain it may be eosinophilic. But now when you use a toluidine blue is best to visualize mast cells because the granules of the mast cell are going to absorb it. So that is why it's going to be colored like that. But now electron microscopic view, you have these granules here. You have the mitochondria, you have the granules of the mast cells, you have the nucleus of the mast cells here. So you need to know that the granules of the mast cells are going to contain, so they contain eicosanoids, so prostaglandin, leukotrienes and all that. So now this diagram is just involving the allergic response. So when you have an allergic response, you need to know that what when you have a primary exposure to that particular allergen, normally you have the FC receptors located at the level of the membrane of the mast cells or even the basophils. You have the FC receptors, but the FC receptors are inactive. Now when you have a first response, when you have a first exposure to a particular allergic product, example penicillin, or you have to allergic to certain food, you have food, you have drug like penicillin, food like any nuts, you have pets like the pets, the dandas, pollen grain and all that. So when you have the exposure to these materials, the B's lymphocytes are now going to produce immunoglobulins, that's IgE. Those IgE are going to bind now to the FC receptors. Now if you have another exposure, a secondary exposure again to that same allergen, now the allergen is going to now bind to the IgE FC complex. Is going to bind to the IgE FC complex. When it binds to the IgE FC complex, it's going to now, the mast cell is going to release now all the products of the granules, and the products of the granule consists of histamines, it consists of prostaglandins, it consists of leukotrienes. So all these eicosanoids, the elements which are formed inside the mast cells, all of them are going to be secreted, and that's going to produce an allergic response. That's a type 1 hypersensitivity. The next thing to visualize here is going to be the connective tissue fibers, the type of connective tissue, the connective tissue fibers. So the connective tissue fibers, you have three main connective tissue fibers. We said collagen fiber, that's one. The second is elastic fiber, and the third is reticular fiber. Okay, so this is just a diagrammatic representation of all, but what is much more good for us now is that the two connective tissue fiber, that's collagen fiber and this elastic fiber. So collagen fiber, you see this thick fiber here on the diagrammatic representation is going to be collagen fiber, while the thin fiber here are going to be elastic fibers. The elongated cells that you see here, which are much more aligned now with the collagen fibers, are going to be the fibroblasts. So all that is a representation. So this is a representation of a loose connective tissue, as you can see here. Because dense connective tissue, we are going to have pack of collagen fibers. This is a loose connective tissue because it's not very intertwined. Now the next one now, just like you see, this one now is a dense connective tissue. Here we use an elastic stain. So this is an elastic stain that we use here. So in the elastic stain, so here when you use a this stain here that has been used here is not a hematoxylin stain, it's a Verhoeven stain. When you use the Verhoeven stain, all of them are purplish. But now when you use the elastic stain, like in the case, because you don't want to stain collagen fiber, you just want to stain the elastic fiber. The elastic fiber are going to stain dark with the elastic stain, and then the collagen fiber are going to stain pinkish, as you can see. And this is a representation of a dense connective tissue. Now this now is the electron microscopic view of collagen fiber, of the collagen fibrils. You need to know that the collagen fibers is made up of, so collagen fiber, you have different types of collagen. You have type 1 collagen, type 2 collagen, type 3 collagen, type 4, type 5 and type 6, type 5 and type 6 collagen that can be seen. Is it clear? So based on this different type of collagen, you have their different location, as you can see here. So the types of collagen, the synthesizing cell, the main location, the main function, example of collagen disorder. But before I continue with this, I'm just going to tell you that what each collagen fiber is made up of collagen fibrils, and those collagen fibrils are produced by fibroblasts, and those collagen fibrils again, can be divided into type 1, type 2, type 3, type 4, and type 7, type 4, type 5, and type 7 collagen fibers. So these are the different. So the type 1 is produced by the fibroblast, osteoblast, odontoblast. Type 2 are produced by chondroblast and chondrocytes. So this you are going to see mostly this inside cartilages. Type 3 are going to be produced by fibroblasts, reticular cells. So this type 3 are also called reticular fiber. Type 3 collagen fibers are also called reticular fiber because they are produced by reticular cells, hepatocytes, smooth muscles, and all that. Type 4 we are produced by endothelial cells, epithelial cells, lens epithelial cells. Type 5 are produced by mesenchymal cells inside the embryo, the fibroblast, the osteoblast, and the cementoblast. Cementoblast inside the teeth, inside the tooth. So we have the type 7 is the keratinocyte. Now the location of the types of the fiber. Type 1 is going to be located now in the skin, the ligament, the tendon, the bones, and the dentin in the tooth. Type 2 is going to be located in the hyaline, elastic, and elastic cartilage. Type 2 located in the hyaline and elastic cartilage, as you can see here. Type 3 is located is also called reticular fiber, located in organs which contain reticular fiber, like spleen, the lymph node, the liver, and also the blood vessel and the skin. Type 4 is located mostly in the basement membrane because it's produced by the endothelial cells, that's epithelial cells. So it's mostly located in the basement membrane, that's type 4 collagen fibers, located in the basement membrane, the lens capsule, and then the glomerulus. Type 5 is going to be located more in the placenta because it's present in the mesenchymal cell, the dermis, and most interstitial cells and bone and cementum. Now type 7 now in keratinocytes is mostly going to be based in the basement membrane. Now the next thing is the main function. So the main function of this is to resist force and tension for type 1, resist pressure for type 2, form structural framework and expansible organ in type 3, provide support and filtration in type 4, control the initiation of collagen fibril assembly in type 5, and then type 7 anchor epidermal basal lamina. Now the next thing now is the collagen disorder involved. We have osteosatirosis, or it's also called osteogenesis imperfecta. So it's when the child is born with bone disorder, that is, the bone is not going to be having a normal morphology. So we have also the Ehlers-Danlos syndrome, which is involved with type 1 collagen disorder. The next thing now, if you have you have type 2 now is Niels-Distel dysplasia, and we have collagenopathy type 2. We have type 3 is involved with Ehlers-Danlos syndrome. Here you need to know that what actually Ehlers-Danlos syndrome is a collagen fiber type 1 disorder, but you need to know that what type 3 collagen, before you produce type 1 collagen, you must produce type 3 collagen, which is used in packaging the type 1 collagen. Is it clear? Because you see, that's why you see fibroblasts produce both type 3 and they produce type 1 collagen. Is it clear? So you see that what type fibroblasts are first going to produce type 3 collagen, and the type 3 collagen are used to package the type 1 collagen. That's why, and type 1 collagen is the main disorder of Ehlers-Danlos syndrome. That's why Ehlers-Danlos syndrome is found in type 3 and type 2, because if you have a type 3 disorder, you're not going to package the type 1 5 collagen, so you have a poor type 1 collagen production and formation. So that's why we both have Ehlers-Danlos syndrome here and Ehlers-Danlos syndrome here. The next one is type 4 is Alport syndrome. We say that what Alport syndrome is usually characterized by hematuria. Are you seeing? So and also Alport syndrome is characterized by hematuria and the abnormality of the ear. So you need to know that what the hematuria, because you said that the type 4 was located at the basement membrane, was located inside the lens capsule, and was located inside the glomerulus. So this patient with Alport syndrome has problem. He has hematuria because the glomerulus has a problem. He has a problem and ear disorder because the epithelium of the ear has a problem. Is it clear? Now the next one is also type 5. Type 5, you have also a classical Ehlers-Danlos syndrome, because also type 5 and type 3 are also involved in the production of type 1, but type 5 is mostly involved in the production of type 1, and mostly that inside the, since type 5 is mesenchymal, so you are going to have the production of type 1 collagen as in utero. So the patient is going to have Ehlers-Danlos syndrome when he's still in neonate. So the next one, we have keratinocyte disorder in type 7 collagen fiber. We have epidermolysis bullosa. Epidermolysis bullosa, what happens here is that when you scratch yourself, you have bully. Just because you have a disorder in the production of keratinocyte. Now let's start working now with each of the so that's the representation of elastic fibers. Now we use the elastic stain. You have elastic fibers, diagrammatic representation, schematic representation here. Now this now is the representation of elastic laminae in the large artery. So elastic laminae are just like that. Now see here you are using a hematoxylin and eosin stain. So you have collagen in the diagrammatic representation here. Here you have collagen fiber, you have elastic laminae. So these are elastic laminae. You see that in the large arteries, elastic fiber are arranged in laminae such that it can be used in reducing the expansile strength, as you can see. The next thing is going to be the diagrammatic representation of the reticular fibers. So for diagrammatic representation of reticular fiber, here you use a silver stain. You see that the silver stain, the reticular fiber is stained dark with silver stain. So why the other fiber are not going to stain dark? So here is an example of a pancreatic reticular fiber. Here you're first going to have a pancreatic lobule. This is a pancreatic lobule, and then the reticular fiber are in between. That's the schematic representation. And here are going to be the ductule, the lumen of the ductule, and then these are the secretory cells which are in the pancreas are going to secrete. As you can see here, these are the base of the reticular fiber is just for anchoring, and here are the cells that are going to be involved in the secretion. Now this is the same. We also have reticular fibers at the level of the liver. So this is the schematic representation. The liver cells are going to be organized at the level to produce sinusoids. So the sinusoids are going to be located in between two layers of liver cells. So this is one sinusoid and another sinusoid here. And then these are the reticular fibers which lie above the different hepatocytes to join them. So as you can see, we have the reticular fibers here as such there. So we are finished now with the first part of the connective tissue. Now we enter into the connective tissue, the types of connective tissue. So thanks for your kind attention.